Human Services, Finance, and Policy. On our agenda today is a 90-day review with DHS Commissioner Harpstead. Members, I'm going to ask you to keep your questions until the end of the Commissioner's presentation. We do have some folks who are at a press conference, and so they will be here about 10:30, but we want to get started, Commissioner, so welcome to the committee.
Well, Chair Benson, committee members, thank you very much for today. My name is Jody Harpstead. I've served as the Commissioner of the Department of Human Services for the past 99 days. And I want to thank you for the opportunity to present to you my 90-day report. I also want to thank Chair Benson, who challenged me when I started to have a 90-day plan, which I did and presented to you earlier. As a reminder, the elements of my 90-day plan were getting to the bottom of reported payment issues, filling open positions and building a new team, building relationships with constituents, listening and communicating with transparency, and driving the innovation in the department that has brought healthcare contract savings to Minnesota. My mantra for the last 90 days has been that there is nothing more important for the Minnesota Department of Human Services than to be trustworthy for the people of Minnesota, the over 1 million people we support to live in community, and all taxpayers, period. I found this set of mission, vision, and values when I arrived at the department. The mission of the Department of Human Services is working with many others, helping people meet their basic needs so they can live in dignity and achieve their highest potential. And our vision is that when we help each other, we create a brighter future for Minnesota. I'll let you read the values. I've had an opportunity to travel in the state and see some of the things that are supported by the department. One of the first things I did, and one of my favorite trips this year, has been to the Community Behavioral Health Hospital in Baxter, Minnesota. I've always been in awe of people who could de-escalate behaviors and work with people. And when I went to the Community Behavioral Health Hospital, which serves people with serious mental illness, I thought if there was ever a place where you might sometimes need to use restraints, it might be there. They showed me a quiet, dark room where people can go for quiet time. They have a chair with restraints. They haven't used it in 2 years. So I'm completely in awe and inspired by people who can do that work. And contrary to the comments that I have often had in the last 90 days, I have often said, those are the people with the hardest jobs in state government. I had a chance to visit the Indian Health Board in South Minneapolis. They're doing a beautiful job of integrating not only social determinants of health with health, but also cultural practice. They're teaching young people drumming and correlating it with health outcomes. I'm delighted to find that we are going to be able to provide new housing benefits for people with disabilities through Medicaid. I visited the Wilder CCBHC in St. Paul, which is also integrating community service and healthcare in a very neighborhood-grounded, culturally appropriate way. I've continued the conversation I started before I came to the department on African American family preservation. We have community meetings coming up to continue to talk about that, and I'm excited about the possibilities. I went to the Leech Lake Band of Ojibwe to present their SNAP Ed program with a Circle of Excellence Award. They are teaching children and their families to shop for, cook, and eat healthy food. And of course, we're very proud of the historic increase we've had in MFIP this year and its possibilities. I asked people in the department when I came to remember why they came to the Department of Human Services. Let's keep our eye on the ball. And so I wanted to share with them why I came to the Department of Human Services. It was to see what I could do to create better health, fuller lives, and lower cost for all Minnesotans in that order. Moving the needle on equity, especially racial equity. And getting the department's processes and systems humming like a Swiss watch so our good people can focus on fulfilling their mission. What I found, the same quality, caring, and competent people I worked with in the Minnesota nonprofit sector. In a department of some 7,300 employees, 7,200 plus have simply continued to do their good work this year throughout 2019. Most of the DHS team would say they came to DHS to support their neighbors in living full lives, not to dot the I's and cross the T's. And some of the people at DHS love to dot I's and cross T's, and they're very good at it. But they came to do that work at DHS to support their neighbors in achieving their highest potential. In terms of our process controls, what I have found is that we have a high-capacity department that I would call soft around the edges. We need to sharpen soft, interdepartmental process controls to be sure service payment decisions are signed and documented by the right people. Just to reiterate, soft, not zero. Interdepartmental, we have people making good decisions in different departments, but they need to talk to each other across departments more. And process controls that I want to distinguish from financial controls. We pass our financial audits, we use generally accepted accounting principles. The issue is process controls. It's my belief, after some time there, that the Minnesota Department of Human Services has always operated this way. We've been addressing some issues that go back 10 or 20 years. Governor Walz hired me to clean this up and move forward with processes we can all count on. And DHS hired or trained their first Lean Six Sigma Quality Control Green and Black Belts, which is a proven approach to tightening controls, in 2011. Examples of their track record, you remember when direct care and treatment, the St. Peter Hospital and the Anoka Regional Treatment Center were in the headlines 3 years ago. Quiet now, they've really turned that around using Six Sigma quality control. Our child care investigation process has turned around using the same approaches. The vulnerable adult process at the Office of Health Facility Complaints. And Governor Walz likes to say that nobody reports when the planes land on time and safely. And you haven't heard about our MinCare re-enrollment process this year because it's been as smooth as silk. We've had people in and out of our Anderson building for several weeks now, re-enrolling in MinCare. This is the list of the payment issues that were raised in 2019. The overpayments for tribal MAT, settle up of IMD overpayments, deceased beneficiaries, Minnesota Care premium refunds, cash assistance over recovery, 16 ANC reports, and Title IV funds. I want you to note the right-hand column on who reported this issue to the legislature. The first couple were reported in 2019 by the press, the rest by myself, directly to you as soon as we knew about them. They add up to $106.5 million. Sunlight is the best disinfectant. I want to thank every employee, manager, and auditor who found these issues. Each one is a trail marker pointing to another process control step that will prevent future problems. We will not suppress or retaliate against anyone inside DHS who comes forward pointing to problems, and we intend to have a culture where people feel encouraged to surface problems. I've been calling legislative leaders in the press myself to model DHS behavior of ownership and accountability for problems. Every dime matters. We've reported inappropriate payments this year. The decisions made by the Department of Human Services over many years that led to these inappropriate payments were not trustworthy decisions. I am deeply sorry to our community partners, such as tribes and counties, as well as individual Minnesotans who were affected by these decisions. The total picture, DHS is not in a free fall, in crisis, in total chaos. The total from the issues reported in 2019, $106.5 million over 6 years. The total DHS payments over that period of time, $96.1 billion. And so these issues add up to 0.1% of total payments, and we're going after the 0.1%. Everything else you'll hear here about the process controls we're putting in place are to go after the 0.1%, because every dime matters. About halfway through this quarter at DHS, I asked one day, does the federal government ever pay us back? I can only imagine with the complex system at CMS and the complex system at DHS that regular end-of-period accounting adjustments would happen all the time. And yes, as a matter of fact, they do. So recent errors for which DHS has had to repay the federal government is $103.3 million of the $106.5. and recent issues for which the federal government has had to repay DHS $94 million. You may remember a multi-year cleanup of the Sears system that we use to find fraud among providers, $10 million, and the settlement of the BHP lawsuit with CMS for $84 million. In terms of our process improvement, we have instituted Operation Swiss Watch. It kicked off last week, and I've heard already from a couple of my managers that our team has been into their shop beginning to map out our processes and systems as they operate today, and they've enjoyed the process, and they're learning a lot as the people who think about process control come in and ask a lot of questions and are starting to understand their systems. We've also put in place Operation Stopgap. I didn't even have to say anything before our compliance department and our process control department put in place Operation Stopgap, which means that any payment decisions made from now on will have the proper signatures on them before we start to write checks, even as they go to map out the entire process across the department. We also have an RFP out right now to bring in an outside process control expert to see if in these two steps we're missing anything. And we intend to add additional experts to the department over time. I wanted to add a word about child care assistance. The 2019 Child Care Assistance Program legislation enhanced our CCAP program integrity requirements. It strengthens provider administrative disqualifications and penalties, increases investigations and license oversight. We've done 76 investigations out of the Office of the Inspector General this year. It funds case tracking systems, increases grants and training for county fraud investigators, and funds planning to improve registration and oversight, including electronic record keeping and billing. One of the tools we have used is continuous process improvement. Many of you have seen those charts of the before and after process. It started in January with our provider investigation unit in the Office of Continuous Improvement that we rolled out a new process in July. We will leverage the work of a new early and often monitoring team. The goal is to identify and mitigate potential fraud, waste, and abuse of CCAP dollars as early as possible. We've also worked in these 90 days to centralize our financial controls. In October, the procurement division moved under the CFO. This area facilitates over $650 million in spending and manages over $500 million in assets. And also in October, the financial team within the Healthcare Administration, our largest business area, was restructured to consolidate the financial responsibilities into one position, which now reports up also through the CFO. Our Financial Operations Division under our CFO is also proposing additional resources, but it already hums like a Swiss watch. Our Compliance Department has had initial conversations with department senior leaders about long-term risk assessment. What do you see on the horizon, not just what's right in front of you? And they've uncovered our two biggest long-term risks, which would be, no surprise, needed systems upgrades and updating our process and procedure manuals so every new employee understands exactly what to do. What can the legislature do to help? First of all, I want to thank all of you. I have heard over the last 90 days that some people consider yours the hardest jobs in the legislature, that you would commit to learning the complexity of the Department of Human Services and understanding the dynamics of our health and human service systems. So I appreciate that, and I appreciate all the time you spend getting up to speed and really trying to understand this very complex system. So one thing the legislature can do is to support additional green and black belts, compliance, financial control experts, and IT systems for us. We have a list of proposed legislation that my staff has shown me that apparently has been proposed for several years but not passed. One list of things is under the heading Federal Compliance, and another list of things is under the heading Program Integrity. And so I would ask you to help us with the unexciting work of good government processes. These are not flashy bills. They don't make headlines. They won't appeal to constituents necessarily, but they are the unexciting work of good government processes. And then, as always, to factor process integrity into legislation. We are being asked a lot this year to consider deregulating childcare to make it more available and to deregulate PCA services so that can be made more available, and yet we have to have tight controls. And so the art of figuring out just how much regulation to put in place without too much is the challenge for all of us. I also noted this year that everything starts on July 1st. So the legislature passes bills for some really important new services, and we are expected to stand them all up on July 1st. And I noted this year that that is when our 16A forms pile up, as we're trying to get everything up and going at the same time. It might be helpful if some things started on August 1st or September 1st, just to spread things out. And then, as always, the time to stand up new services and payments. Senator Benson and I were in a meeting sometime over the 90 days where someone said, just get this started right away. It doesn't have to be perfect. Not the messaging I've been getting over these 90 days. And so always trying to balance getting things going fast and doing them well. This is our new org chart, and you have a copy that you can read better than this slide. But just to go over the thought process behind it. We've cast a wide net looking for leadership talent and diversity. We've added 3 positions on that chart and eliminated 3. At least 3 of our 9 open positions will be filled with people of color. I've been really delighted at the people who've come forward and are interested in working with us. I think of it as sort of 4 circles, even though they're not circular on the chart. There are the assistant commissioners of our service administrations who report directly to me. I want to keep track of what they're doing. I want to understand their work, and it's helpful, especially as I get started, to have them all report directly to me. Our agency-wide administration and controls are being consolidated even further than they have in the past under Deputy Commissioner Chuck Johnson. And let me just take a moment to say I could not have gotten through the last 90 days without Chuck Johnson. He knows the whole department, he knows the history, and he's been an invaluable partner to me. We've put the compliance department under him, which wasn't there before, so he now has the CFO, the compliance department, the IT department, and the continuous process improvement team. Another circle, if you will, is what I call communications and relations. I'm now looking for a deputy commissioner of communications and relations. It's very clear to me, as we have so much taxpayer dollars to spend and so many people to support, that we need a full-time person looking at listening to constituents and communicating with transparency to people. And then equity. I'm adding a chief equity officer reporting directly to me. We've had some marvelous equity work going on in pockets in the department, but we haven't had an agency-wide approach. And so by putting in a chief equity officer, I hope to make sure that we have a consistent approach across DHS to examining our own internal biases and then looking at our work through an equity lens. The structure reflects our commitments to better health, fuller life, lower cost, equity, and process control. And just a couple comments about recent hires. Our new legislative director, Matt Burdick, is here today. I know you all know him, and we're delighted that he's taken this regular position with us in the Department of Human Services to continue to work with us and with you. Last week, we announced the hiring of Assistant Commissioner for Community Supports, Gertrude Matemba Mutasa. She comes to us from the Phyllis Wheatley Community Center, which she helped to turn around both financially and culturally over the last couple of years. And that is exactly what that group needs inside the department, and so we're excited that she starts on January 6th. When she does, Stacy Twite, who's been the interim assistant commissioner in that spot, becomes my chief of staff. We've also added a position not on this chart, but reporting to Gertrude, and that is a new Deputy Assistant Commissioner for Disability Services. There's plenty of work to do on the behavioral health side of our Community Services Administration, and I wanted to be sure that Disability Services had everything it needed to stay and remain stable. So I'm so excited that Doug Annett, the Vice President of Operations of Opportunity Partners, is joining us as Deputy Assistant Commissioner for Disability Services. We've also in the final interviews for the Director of Disability Services. You all know Alex Bartolak, who's retiring after the first of the year. And so when Doug comes in Monday, the 16th of December, he'll make those final interviews and choose the person for the Director of Disability Services. And so you can see we've doubled our investment in the leadership of our disability services. You might say it took 2 people to replace Alex Bartolak. I've asked our senior leadership team to craft their 3-year biggest possibilities. It's a tool that I used at Lutheran Social Service. As you look out for the next 3 years and you think about the work you're committed to and why you came here, what are the biggest possibilities of that? If everything went well and you could make it happen, what's your biggest possibility? And here's a few samples of the drafts they're working on. Marshall Smith, Direct Care and Treatment, says he wants to achieve the readiness criteria for the Malcolm Baldrige National Quality Award. So this was the group you read about in the paper 3 years ago at St. Peter and Anoka Treatment Center. Today, nice and quiet, going well. Now they actually want to achieve the readiness criteria for a National Quality Award. If they do, he tells me they would be the first department of a state government to win that award. Lisa Bailey in Children and Family Services wants to capture and organize our statewide commitment to big picture reform of our child welfare system. Tom Moss, our interim healthcare administration commissioner, is eager to establish integrated health partnerships 2.0. And so far, my biggest possibility is that 50% of all of our senior managers will achieve their biggest possibilities as we work together. We've also been working to support employees and build our culture. The first step to that always is the strong management team, a mix of veterans and fresh ideas, but people who have managed organizations. We're crafting an employee vision statement. We have a vision statement for the people we support in community, but I'm eager to have us craft a vision statement for how we want it to be to work in the Department of Human Services. So we have a team working on that now. We've trained many of our people on our collaborative safety model. It was a model developed by a nonprofit leader that helps us tackle problems without tackling each other. And it's a good way to work through issues. So generally, we are talking about wanting to become tough on process while being supportive and encouraging to people. Relationships totally matter in our work, so I've mentioned our Deputy Commissioner for Communications and Relations. We're also rebuilding a former county advisory board at DHS, and as we started to do that, the county suggested we should invite tribal leaders. So now it's a county and tribal advisory board. Serving over 1 million Minnesotans and spending billions in taxpayer money, we have a particular obligation to excel at listening and communicating. Huge demands on our department to be listening and communicating. We're also working to develop new flexibility around discussing issues with key partners instead of surprising them with new information. We've been calling you when we needed to tell you about something going on. We brought the Association of Minnesota Counties and MACSA together to tell them about the 3 issues that we had to announce related to counties and talk to them about the best way to implement them, and we're still in conversation with them now. Innovation, the last part of my 90-day plan, better health, fuller lives, and lower costs, in that order. Minnesota's already a national leader in new models. You should know if you don't. Our integrated health partnerships is a model across the nation. Accountable care organizations, the incorporation of social determinants of health, our certified community behavioral health clinics, and a 2-generation support approach to people living in poverty. One result I wanted to share with you, because I'm not sure you've seen it, I hadn't until we did this, that our average managed care capitation rates increased 8.3% per year for 10 years, from 2000 to 2010, and they have decreased 5.7% per year from 2011 to 2016 due to our competitive procurements. Speaking of which, we have a new procurement plan. I think you all know by now that we are not doing a Medicaid healthcare procurement in 2020. All our current contracts will stay in place with no disruption of coverage. Consumers of healthcare in Minnesota have access. Plans have relatively good rates. It gives us a chance to discuss what Minnesotans really want in these healthcare procurements. It gives our new Assistant Commissioner for Healthcare and Medicaid Director a chance to get their feet under them, and it gives DHS a chance to launch our new process control effort before doing a major procurement. So our new procurement plan is to procure our rural children and family healthcare with an RFP in 21 to start in 22. Our senior and coordination services, RFP in 21 to start in 22, and our metro children and family health care, an RFP in 22 starting in 23. Thinking back a bit to lessons from 2019, Most of the payment issues we're addressing now did not happen in 2019. They went viral in 2019, and we've put stopgaps in place in 2019. The confluence of DHS resignations and media coverage of tribal overpayments in the summer kicked off a frenzy that has led to a view of DHS as a department in serious disarray. The resulting outcry caused pressure on employee relationships in the department, making it harder to get the good work done, not to mention our biggest possibilities. Democracy isn't easy. When we run billions of dollars of taxpayer money and every Minnesotan has an opinion about how it should be spent, we quickly become the department everyone loves to criticize. Fair enough, we can live with that. I would ask Minnesotans to look at the department's overall results, read the stories of the lives supported with their tax dollars through DHS's work, and make a fair judgment of the total picture. Trust takes time. At last week's House Committee hearing, I said that trust is rebuilt by being trustworthy over time. We hope to have our whole senior management team in place before the 2020 session starts. We'll work to put process controls in place over the next 6 months or so. In the meantime, we have stopgaps in place. And large organization cultural change usually takes 2 to 3 years. We have talented people on all these initiatives. I'm very proud of the progress we've made in 90 days. We look forward to regaining your trust in our work. Over 1 million Minnesotans are counting on it. I wanted to add my visit to Clare Housing in Northeast Minneapolis last week. We took a tour and gave them our Circle of Excellence Award. With 7 housing facilities in the Twin Cities, they've been serving people living with HIV and AIDS for 30 years. Their experience connects housing with a 90% viral suppression, a health outcome of a social determinant. It's really extraordinary work. As our new DHS internal control measures go into effect and new leaders come on board, I intend to spend more of my time and energy on what I came to DHS to do: better health, fuller lives, and lower cost for all Minnesotans, and moving the needle on racial equity. Should we break up the department? The governor and I have been talking throughout my first 90 days about how the department should be structured and whether restructuring the department would improve efficiency, accountability, and delivery of services. The governor will be making an announcement in the coming days on this matter. I would like to add that it's been suggested that I implied last week that I'd already made up my mind on this question. As I answered a question, apparently I listed more cons than pros. As I weigh the pros and cons on this matter, I come up really quite neutral on it. My major concern would be timing. We certainly want to be able to put our process controls in place before pondering and sourcing the conversation of such a restructuring. I'm excited about our new Commissioners Advisory Panel for 2020. Its charge is to review progress and advise me on restoring the trustworthiness of the department. So we've had our 90-day plan, now our 90-day report, and going forward, I look forward to working with this advisory panel on process controls, department organization structure, management team development, and department culture. I'm excited that Bill George, former Medtronic CEO, has agreed to co-chair. We're still finalizing the second co-chair with 2 great possibilities. I'm very excited that the 4 legislative chairs of our Health and Human Services committees have agreed to participate, and we're trying to round it out with 2 to 3 other community leaders. I'm proud to be the Commissioner of the Department of Human Services. The people of the department came to DHS to support their neighbors in living in community and achieving their highest potential. We're attracting strong candidates for our open positions who are honored to be asked to join us. And I ask for your support as we work to strengthen the process controls, build a strong team, strengthen our relationships, and continue our innovation. And I'm proud to be a Minnesotan. I've been thinking a lot about this in recent days. In every sector in which I've worked, we all come home from national conferences thrilled to be doing our work in Minnesota. I've learned that Minnesotans uniquely believe that we have an obligation to care for our neighbor, and if we apply ourselves, we can make things right. Minnesotans love and excel at the art of democracy, so bring on the conversation. And finally, there's nothing more important for the Minnesota Department of Human Services than to be trustworthy for the people of Minnesota, the over 1 million people we support to live in community, and all taxpayers, period.
Thank you, Commissioner. And I first want to say how much I appreciate getting a phone call from you about things that are going to be emerging in the press. It takes the temperature down, which is really important when you're actually working on solving problems. My dad regularly reminded me, emotions don't solve problems. So thank you for open lines of communications. I am pleased to see a 2 to 3 year timeline that you intend to keep working on process improvement. While you might not stay the entire 2 to 3 years, I think it's important for members of this committee and for the stakeholders that attend hearings and are watching the Department of Human Services to understand that this 90 days was the first mile of a marathon, and it is going to take a long time to establish the trustworthiness, to make accountability and transparency the watchwords of operations. And so I was grateful to see that in your report. It's my expectation that we, as an oversight body, will continue to put pressure on the department and expect accountability, and that you, through the skills you've developed as an executive, will find ways to implement continuous improvement plans and develop the accountability, trust, and transparency that Minnesotans expect. Members, I'm going to let you go to questions that you might have, and if you have none, I do have a few that I'm happy to address. So do we have a list? Not yet? Okay. Well, then I will go to the DHS breakup, something that has been raised time and time again. Actually, there was a pretty comprehensive report done by MMB issued in July of 2013. So I will have my team make this available to you. I don't know that we need to hire yet another outside consultant until the key stakeholders sat down and looked at this. And pages 11 and 12 in particular, study number 2, the multiple DHS roles. Move DHS licensing division to MDH. Item number 2, continue current DHS restructuring effort. Number 3, develop a transition plan. Direct care and treatment could be removed from the rest of the agency and recast as an agency of its own. So we do have a significant, hefty body of work. It's at the Legislative Reference Library, but I can make sure it gets sent over to you, and we can make it available to members of the press and members of the committee as well. If we're going to take this seriously, when I discovered this, why have I been trying to reinvent the wheel? So I'm going to go back and do my homework before I make any further suggestions. And Senator Draheim, who has been my point person on this, I'll give him a copy of this as well.
If I might?
Yes.
Earl Bakken of Medtronic always used to say, nothing's ever invented, it's just rediscovered.
Yes, and this is a rediscovery for me, and so I want to make sure that we don't lose this, that we don't spend more money on outside people until we've taken a deep dive into this work.
Thank you.
With regard to the Carolyn Ham issue was emergent in the House hearing, and you and I have talked about it. You've told me over and over again you want to hire the most talented, capable people. And I just want to say that the decision to retain her, even if she's not sent back to OIG, raises questions. She did not do top-tier work as she was running the Office of Inspector General. And I know you want to bring in people with unique perspectives. That seems to be a protective status quo retention decision. And I know you can't talk about personnel issues, but how are we going to get comfortable that you are really looking for top-tier talent when somebody with that level of controversy is being retained? And a little deeper dive, there are a lot of Minnesotans who, if they performed the way some of the folks at the Department of Human Services did, letting millions of dollars go out the door and nobody signing off on it, they would have been fired from their jobs. And so how are we going to rebuild trust when it doesn't appear that there's accountability? So if you could address those questions for me.
First of all, in terms of the accountability, I want to say that if we didn't have these kinds of process controls in place, and we give people jobs and expect them to do their jobs without the tools they need to do their jobs well, it's hard to justify firing someone for doing the job they were given if they weren't given the right tools to do them. So our employees and staff need these process controls in place as much as any of us do in order to just do their jobs and trust that they're doing the job properly. So I think these process controls are a tool for our employees that are as important as they are to build trust with the rest of Minnesota. The only way I think that you'll be able to see that we intend to have the best talent in place is to see it over time and see it perform and watch our team as we go forward. I appreciate it can be frustrating when a person has been high profile in the public and a surprising decision is made when we can't talk about it. But I can assure you that I've read that report and I concur with the decision that's been made in this case. And so now we'll just have to show you what we can do with the team that we have and the team we're building.
And Commissioner, with respect to Ms. Ham, she was pretty high-level management. And so I don't find the reasoning that resources weren't available to be applicable in her case. She could have requested resources and led specific changes if she thought the department wasn't running well. And so we will not have access to the HR report. That's just the nature of human resources. But it's going to cause a gap in trust for time to come with a lot of members of the legislature. And with regard to folks not having guidance, there were multiple layers of management. Management's job is to provide that guidance. And so again, I will do trust but verify. Frankly, when you have 6 layers of management and nobody's checking, that's not because resources weren't available. It's because people didn't know how to do their job. And you should not be a manager if you can't both serve and be accountable. And so I think, and I'm expressing my frustration, but I think there are millions of Minnesotans who aren't getting that question answered. Mm-hmm. Why can somebody be a manager if they're not both action-oriented and accountable? And so this is the ongoing challenge we're going to have. They should have had those systems in place. I know that you are doing it, but there is a level of frustration with people who are having to write checks to pay for their work that is not being done. And so I'm gonna stop with that. You know how I feel about it. We have talked extensively about this. If an employee makes a complaint, raises a compliance issue, raises a management issue, are those comments left confidential? Is there a confidential place that they can report that so that action can be taken without their manager knowing or without them being named?
There are places that there's a whole system in place where people can report problems, and then I don't know all the specific details of that process, but there is a process in place that should be a safe place for people to be able to report things that they see. If they don't feel that they've been able to share them with their manager, there's another place that they can go with those issues, and they'll be treated respectfully, and it's expected that they don't face retaliation as a result of reporting them.
And if, Commissioner, if somebody did face retaliation or their confidential request wasn't kept confidential, would you terminate the person who didn't keep the confidence of the employee?
Well, first, if someone felt they were retaliated against, they would need to report that, and then we would start an investigation on the person they reported on. And then that person has a whole due process. We'd have to corroborate that and be confident that that really happened, and then we could take disciplinary action.
But if an employee reported something in confidence and the person they reported to didn't keep that confidence, is that a fireable offense?
I'd have to double check exactly whether that is or not. If someone has reported something that's not going right, you need to tell the person that can change it about that report. So
I have had some concerns raised that when employees ask for something to be looked into, they're concerned that they actually can't tell their story to someone for fear that through gossip or an official channel that their name will be released and there will be consequences. And so I think there are still some internal trust measures that are going to need to be built if you're really going to be on a 2-year journey of trustworthiness. There are good people who are trying to do the right thing. I believe that. I also believe that if they can't act without retribution, a former DHS employee actually came to me and said, I can give you the series of emails where I tried to make changes and was demoted because of it. And it was prior to you. But there are people who are still afraid. And I know you are trying to change that and you take it seriously. I just want to raise it again so that, first of all, the people inside the department who are worried know that they're being heard and that you are fully aware of it going around any process that would have been in place before. Getting to things that happened before you, are you checking in with previous commissioners? I know Interim Commissioner Wheelock is working with you. Tell me about her and what her role continues to be, and then other commissioners. You don't have to name names, but are you getting some comfort with the special club that you are now a part of?
Yes, I have been, and reaching out to a couple more in the next couple of weeks. Pam Wheelock has been continued to stay with me to troubleshoot several problems inside the department, not at a very public role, but taking things off my plate to dig into the solutions and answer some questions for us. It's been very, very helpful.
Okay. Thank you. Trying to see. Hayden and Abler have hands up. Senator Hayden and Senator Nelson. I knew if I took long enough, y'all would come up with something. Senator Hayden.
Well, thank you, Madam Chair, and thank you, Commissioner, for your very thorough report, or at least as thorough as it could be after 90 days. I know that it has been a lot to kind of grapple. I, too, want to say thank you for the steady line of communication, us directly as well as your staff, when things are happening or giving us kind of updates as they've come along. I really appreciate that, and I think that it's been helpful. I also want to kind of go down this line a little bit about that Senator Benson, Chair Benson, was talking about ensuring that people who feel like they see things that are going on that they don't think are appropriate, that they have the way to do it in a way that they don't feel like they're being retaliated against. But there's another side of that I saw too, that is to ensure that people who are saying that they think things are not happening, that we don't take that as simply gospel, that we actually thoroughly kind of walk that through and ensure that the manager or the person that is in charge of that, the layers of management, that they're doing their jobs appropriate too, and that the appropriate level of, I don't know this microphone, I don't know where I'm at, it's going in and out, but the appropriate amount of caution is happening. One of the things, and I know that we don't have our chief HR person here, so I don't want to go into the specific way in which this handles under the law, but one of the things that I think that happened in the IG department, at least from my perspective, as I've talked to many people, as well as your process improvement person, the legislative auditor, is that there was a lot going on there that the frontline workers maybe needed some training and some improvement on. And so I'm very careful to allow you and allow your team to be able to figure that out and get that on the right track without demonizing a particular individual. It could be that they just weren't trained very well. It could be that they were incompetent. It could be that the system that they were working in didn't allow them to do their jobs effectively, starting from the manager all the way to the frontline workers. So I guess we've had this conversation before, so I'm just hoping that we continue to make sure that the system works up and down the process, and just because, so I get those same calls, someone calls me and says, well, hey, this is a problem, that I can feel confident in you, which I do today, that I can get that information to you, and that everybody is protected, and that we're focusing on the client or the patient, and then the folks that work with them to ensure that the work is getting done, and not just take that person's that particular individual's word as the gospel, because maybe there's an ulterior motive for them, or maybe they just didn't understand it, or maybe they actually do and they're right. But I think that it's really important that we do that. I actually, and I've said this before in this venue, from my vantage point, Ms. Ham wasn't treated very well. Not that I understand the particulars that went back and forth, but the way that we treated her or any other employee when we start naming them by name and asking for them to be removed and terminated without fully understanding the story. I think that that's unfortunate as well. So once again, I think for me, it's as much about kind of watching your progress. I feel very confident that we are kind of moving the right way, but I caution us to be careful not to take every single person that calls us word as gospel, but to allow us to go through a process that makes sure that what they're saying actually pans out.
So Chair Benson and Senator Hayden, thank you for that. I think it's always a delicate process to help to manage manager and employee relations in any organization ever. And this year, the department's been under quite a bit of pressure with all of the public attention. So it's been particularly difficult to manage some of these relationships. So I appreciate both sides of that question. I've also worked, as you know, to call you and to tell you when we had problems, and then to call the press myself and tell them we've had a problem. So I've been trying to model the behavior that we're going to tell the world what's going on and dig things out and clean them up here and not hide them. And we're building that culture of making sure that our managers appreciate that that's how we want to be behaving. And hopefully then we can further help establish trust with our employees in the process as we go forward with these things. But managing human relations in any organization is a delicate dance, always has been.
Thank you. Senator Abler. Okay. Senator Nelson.
Well, thank you, Senator Abler and Senator Benson. Commissioner, thank you for being here today. I just have a few questions, a comment, a few questions, and so I'm hoping you can help me with that. One is in reference to the comments made briefly here about restructuring and perhaps dividing up the department into different departments, perhaps two is what I'm aware of. And here's my concern, and I'd like you to address this or clarify this. I don't know that the issue, here's what I'm concerned about. If dividing a department into additional departments, I don't know that that really gets down to the nitty-gritty hard work of figuring out exactly why we have these what have been called missteps, or why we've had some personnel issues, or why we've had some issues with fraud. What I see in setting up a new department, in addition to, is another commissioner, another assistant commissioner, another silo, another place for things to get lost in between serving the one customer, customers. We have, one customer, in other words, a Minnesotan who is now working with one department, and now they're trying to work with two departments. I just don't see that would, I don't understand how that might be helpful. And more importantly, I see that it could be more costly. I see it could lead to less transparency, less accountability. Well, that's not my fault over here. That's this department over there. That type of issue. So I'm just wondering if you could address how breaking up a department into, let's say, two departments will actually help do that very hard work of making sure every dollar, every dime, every penny is spent not only as intended, but in the most effective and efficient manner?
Chair Benson and
Commissioner
Senator
Harpstead.
Nelson, that's a good question. And that's one of the arguments on the side of not breaking up the department. There are other arguments on the side of making it smaller, perhaps that people could just focus on part of the work and be more intentional about that part of the work. But that's a good question too, and whether size is the issue or these process controls that we have laid out is the issue. And should we do both or just focus one at a time? So those are all good questions, and that's the issue at hand.
Well, thank you. Well, and then just to follow up, I don't, for 1 minute, think that there's one person, except perhaps you, that is doing everything at DHS. I know that you have the ability to make sure that individual people have individual responsibilities. And I don't know where I stand on this restructuring. I'm just telling you what my initial thoughts are based upon just life experience, quite frankly. So I will watch that very closely, but I do want to make sure that you are aware of those concerns as this discussion goes forward. And then I also wanted to see if you could speak a bit to, and if this is not the appropriate time, you can tell me, maybe it's too soon, but the Child Care Assistance Program. There was a pretty lengthy report several months ago about, there's no nice way to say it, fraud. And I would like to know, are you at a position today, and if so, can you tell us what specifically has been done to make sure that those holes in our system, those accountability holes or those incentives maybe that weren't aligned properly or we lacked some rigor, what has been done so far to make sure that that doesn't happen again? And I just say, you know, some of our most needy families are depending on that for work. Some of our most needy kids are depending on those services, and we just cannot afford to allow any more, as you say, dimes or pennies or dollars to actually filter through without hitting their intended target.
Yeah.
Commissioner
So,
Harpstead.
Chair Benson, Senator Nelson, have you had a chance to see our process before and after charts about how we used to do fraud investigation, how we're doing it now?
Yes, does that do you think that's going to solve the problem?
That's a huge part of it. In a lot of these situations that we've been discussing this year, we need to get these process controls in place so that people can't just make mistakes or shoot from the hip or do what they think is best without documenting their decisions and making sure the right people have made those decisions. And we believe we have that process in place now, and it's working well there. I will say, when you ask if it's too soon, I do know that the group that worked with the legislature to pass the legislation around this is prepared to come back to the legislature during session with a report on the time that's passed and how things are going. But we do believe those process controls are working. We've done 76 investigations in 2019. And I heard the other day from our interim Office of Inspector General that people are feeling like that department has really turned a corner and culturally, and people are working together better. And so I'm getting a lot of signs that things are in place, and I would expect good results from that group going forward.
Thank you. Thank you, Madam Chair.
Senator Nelson.
Commissioner, I'll look forward to that. There were some specific instances that were brought to my attention, and I will relook at that and see if those instances will have been captured in the process update that you provided. And then just two brief things. It's been brought to my attention by some of my constituents that Min Choices has a backlog. And a very specific question. A constituent moved from Olmsted County to a county up here in the metro area, and yet somehow he was disenrolled in his services and was requested to re-enroll, didn't know he had to re-enroll to get, I think it was the health insurance coverage, if I remember correctly, and also was going to need to go through a whole new Min Choices assessment, even though he didn't change. He just moved from one county to the other. And so I'm thinking, this could be happening to many Minnesotans. And I would like you to address, if you could briefly, min choices and this issue about people's moving from one county to another. And would that really require another assessment?
I'd have to dig deeper into min choices myself now that I'm in the place that I am. You heard stories earlier this year about different approaches in different counties and inconsistencies across the state using the min choices tool. Part of that is simply an artifact of our state-funded, county-administered system where there are differences in different counties. It shouldn't be that a person moves and has to start over. I'd have to check into the very specifics about whether an assessment was due again. If you wanted to tell us about that particular instance offline so we could look into it.
Commissioner,
That might help.
thank you. I did contact the department, and the issue was resolved. But my concern is not everybody is going to know to call their Minnesota senator,
Right.
and we shouldn't have a system that would require a call to a senator
Absolutely.
to know that something needs to be done and how to get it done. And then two other brief questions, Madam Chair. One has to do with the counties. I'll just mention this. I'm very concerned that my county commissioners and county commissioners all across this state were following the directions from your new department. And I realize you weren't there then, but our county commissioners were following directions from DHS. And now they're getting a bill for $9 million because they followed those directions. And that means a property tax hit to our property tax payers. And so I'm just really concerned about that piece. Following directions from DHS should not make them liable for implementing those directions. So I know this is also the same with the recovery protocols as well, but I want to mention that to you, that it's hitting every county in this state, and I think it's problematic. And then my last question briefly is about the medical director. I'm just wondering if you can update me. You might recall in earlier this summer, I was concerned about the lack of our medical director not being able to make decisions about our Medicaid programs, and what is the status now? I know that medical director is not with the department anymore. What's the status? Our Medicaid programs are one of the fastest growing parts of our budget, and more importantly, they serve perhaps some of our most at-risk or needy Minnesotans, and I'm wondering if you can give me an update on the Medicaid director that we have in place now, or if we don't, why not, and when are we going to get one?
Commissioner.
Yes, Chair Benson. Senator Nelson, to answer your last question first, we are in final interviews for a new medical director. So we're about to hire a person again. Some of the decisions you talked about, or some of the roles that a person might need to make to be sure that we're making proper Medicaid payments, is our state Medicaid director. So the medical director brings medical expertise to the conversation as we're making those decisions, but most of the payment decisions would be made by the Assistant Commissioner of Healthcare, the Medicaid director, the service administration that runs those programs, and finally our CFO. So there's a lot of people engaged in the payment decisions, but we would turn to that medical director when we need medical advice on a particular decision. And we're very close to an announcement on our new medical director. We have also decided to split the position and to add a behavioral health director so that we also have behavioral health in the conversation when we're making decisions in the department. Going back to your earlier question, it is patently unfair that counties would have to follow direction and then be faced with these kinds of bills. And so that's our next tough discussion together, is to figure out what to do about that. We'll need to talk about whether there's a legislative approach to that, whether there's a payment approach to that, payment plan approach to that we could take inside the department. And so we're going to have to face into that conversation and figure out how to solve that problem together.
Thank you. And Madam Chair, my last comment. Commissioner, thank you. I do appreciate you understanding the severity of that. And then I just want to wish you great success. I appreciate the fact that you're doing Lean Six Sigma quality control. Look forward to hearing about what we learn through that process, and we're counting on you. Thank you.
Senator Abel.
Well, thank you. That was loud. Well, Commissioner, you made it 90 days. That's pretty good.
Yeah. 99.
There you go. And I appreciate what your efforts that you're doing. We've talked numerous times, and I do appreciate the outreach that you're trying hard to do. And I've told everybody who cares to listen that I think that you're a good person for the job. And I think it's very important that you succeed, because I think the next person would be more of a caretaker. And I think that the chance to try to get DHS on track, and I think it still is off track, frankly. And there's lots of work to be done in so many areas, is well under your steermanship. And so I was only going to ask one or two things, and I'm going to offer a few comments, and none of them are new to you. Just to encourage you as you continue to dig deep in this, the math, 1/10 of 1%, all that, like, hooray for that. But, the min choice it's a mess. It's not what anybody thought it was going to be as a person has tried to make it work. From this position here, it's like, nothing to see here, we got it. Leave it to us. And as we try to improve it through legislation, they go like, yeah, and then they push back on almost everything. And that's true of so many different entities, as we as policymakers merely become people with a bully pulpit and struggle to get input into those. I'm just going to leave you with that. And I know that's not what you intend, and I know that as coming out of the private sector where you were living under those parameters, you see more problems than you've let on publicly. And I'm eager to see how every niche with these new leaders coming on can actually be made to function. I still am concerned about retaliation, and I'm concerned about egos in the department where they squish people. And a lot of the good advice you would get coming up from the people below the middle managers is not worth bringing up, because the people don't want to risk their jobs and risk peril at the hands of a level you never see day to day. I'm just telling you that as I talk to people. With the breakup topic, we'll have a lot of discussion about that. I hope that the employees in the direct care part in particular, and wherever else will be affected, feel secure that this is not an effort to change one thing that they do, but just to make it so it makes sense that an agency that develops policy and regulates itself and then disciplines itself doesn't make a lot of sense. And hopefully that if the direct care part is what spun off, and that was, I think, my request, that we do that report back in 2012, and I'm glad it's under discussion, that it's an effort to help them be more secure in their positions and more able to serve in the way that they have charged, been hoping to get. And at the end of this, I just have one question. I'm just bringing a message to you from Anoka County. They're not paying. They just wanted me to let you know that. And so the real question on this is, which taxpayer is going to pay? The federal money is free to us, county money is free to us, state money, we got to pay that, it's in our budget. And none of it's free. Mm-hmm. And I think every penny matters, whatever slogan you had going there, I think there's a lot of pennies and a lot of tens of millions of dollars that have been ill-spent. And as we scrutinize with your good oversight, and actually as your people learn to listen to us and take our ideas not as a competition, but as productive, and we have an ear to the ground that they may not have, that I think that those monies can be much better spent, and we can have more good news about underspending. Anyway, so those are all comments you've heard before, but I just wanted to, you reacted to that, and I'll ask my question.
Yes, if I could, Chair Benson, Senator Abler. So, of course, the same kinds of questions apply to the tribal overpayment, and another problem to solve. And I understand on the tribal side, we have a potential legislative, a potential judicial, and a potential administrative approach to the problem. So my next step is to go fully understand the forecast and budget implications of each of those paths, and then we'll need to talk about how do we solve these problems together. So I'm eager to get into that conversation and see what we can do to get beyond it. But we have two enormous issues here in front of us, and we're going to have to find a way to solve them.
And Madam Chair, and I think if there's any word that I've enjoyed hearing in the last month, that's, you just said together. I think there has not been a sense of together. And not in terms of you have to administer it and the governor does whatever and there's us. But there is a lot of expertise that we have access to and the voices that we represent that I think with a together thing, a collaborative, that would be good. And just my question, speaking of collaborative, can you just, you've been on the insulin work group with the governor. The press says it's collapsed. Has it collapsed? Are you close? I'm very interested in this. I have any number of people who are wondering about this as well, and I thought, here you are, and the governor's a big supporter. Can you just tell me where at least the department's at and what you see happening out of that?
So, Chair Benson, Senator Abler, I'm afraid I cannot. I attended a couple of meetings on behalf of the governor, and then I stopped going to the insulin work group. It was looking like a solution might not include implementation by the Department of Human Services, and I haven't been at the last meetings, and I don't know the answer to your question.
Thank you. And Senator Marty, then Senator Eaton. And members, I want to draw your attention to a document that is the November forecast administrative adjustments. Mr. Greenman came all this way. I want to take a few minutes to call through those, but first we're going to get through our list. Senator Marty.
Thank you, Madam Chair, and I'll pick up on what Jim said and applaud your transparency. And yeah, I think you've heard from the chair, and all of us appreciate your reaching out to us and the media and everybody else. And I think it's instructive how many of the bad news things have been reported now this year by the department rather than come out through some other expose kind of thing. So I appreciate that. I'll say that you use the analogy that financial operations is humming like a Swiss watch. And I had a Swiss watch once, and it didn't really hum, it ticked. But I get the point, and I appreciate it, and I'm glad things are getting better. Wanted to also comment briefly, because I think you've heard bipartisan concern that as you put in place the new processes, that retaliation be, that's a real problem if there is any retaliation that happens. And I don't know how you set it up to make sure it doesn't happen, but retaliation blocks good reforms from happening. So I think it's very important we do that. And finally, I wanted to just raise one issue for 1 minute, just for the chair and you and so on, and that is a concern not directly related to department operations, but just so it's on the radar and everything else, and that is the talk about closing St. Joseph's Hospital in St. Paul, and both for pregnant women who are addicted to substances, for people with mental illness, especially the lowest income folks. I'm very concerned about this, and not sure what the department can do about it or what the legislature can do, but I do think that this should be on the public radar and we should be doing everything possible to protect this. So I just wanted to raise that issue briefly.
Thank you, Senator Marty. And Senator Eaton.
Thank you, Madam Chair. Well, Commissioner, I appreciate your presentation. I'm also glad you're still here after 99 days. I have two questions. My first one is, has there been any assessment of how all this extra misspent money has been used? And if there were, I haven't heard of any problems with misspending. It's been more was spent than should have been. But it seems to me that there was probably overwhelming need out there. Nobody was saying, hey, I have too much money, take it back. I was just wondering if you could address that, if there's going to be any kind of assessment of the impact of the counties, the tribes, whoever not getting the money that they were over allocated.
Commissioner
So,
Harpstead.
Chair Benson and Senator Eaton, I think you mean misspending by the providers who received overpayments? Yeah.
Thank you.
I know of no information about misspending by those groups. And of course, the money was misspent by the Department of Human Services, if we over or underpaid. But I have no evidence that I can think of off the top of my head that there's been any misspending by the providers who received the funds.
Madam Chair.
Senator Eaton.
Well, my bigger concern, I'm pretty confident there wasn't any misspending either. It was, other than it shouldn't have been allocated. But my bigger concern is that there were needs that were met, and now that money won't be going there. And I'm wondering if there's any assessment of the impact of that.
Well, one of the things that I'm actually eager to talk to our medical director about as soon as that person starts is the whole question of opioid addiction treatment, for example, and the state of the medical art. This came up at an earlier hearing. And in addition to the questions about payments, I want to understand how we're doing as a state in tackling the opioid addiction epidemic and what we should be doing medically as well as what we should be doing from a payment standpoint. Also eager to talk to the providers of those services to understand what they've learned about their approaches to treatment and what they think should happen next. So that is one area that I'm very eager to dig into deeper from a larger standpoint, not just the payment, but what's worked, what hasn't worked, are we making a dent, and what else should we be doing medically and from an overall treatment standpoint, and then the payments in that order. So, thank you.
Thank you.
Thank you. Senator Eaton.
I have one further. I'm just wondering with the, I sorely miss Dr. Schiff, and I'm wondering if there's any intention of including or having the medical director be more involved in the decisions made through the Medicaid payments, such as prior authorizations, which I really believe are a medical decision and should be made as a medical decision, not as a funding decision. It's really impacted the addiction community when those prior authorizations were put in. I think most of them have been removed now, but it's happened in other medical concerns as well. And I guess I'm encouraging you to include the medical director in addressing those issues.
Well, thank you. We'll take that under advisement. And I need to understand more of the role of the medical director. There hasn't been one there since I've been there. And so understanding what that person does and what decisions they're involved in, what they should be involved in. And I know I talked to candidates and as we interviewed about how we want to be careful not to ask one physician to answer questions for the entire state. So there may be some good ways for us to have more input to those medical decisions that perhaps that person can coordinate to be sure that we're making really good medical decisions as well as payment decisions. Thanks.
Just one final comment in that I was frustrated with previous commissioner that didn't allow the medical director to have input on prior authorizations.
Okay.
So I would certainly weigh heavily on requesting that you include that.
Thank you.
Thank you, Senator Eaton. And just briefly, there's some outstanding items. The procurement plan, the Department of Administration, through their grant authority, has done this extension. Members, I think this is something we need to pay specific attention to because there was a time certain put in law, and the Department of Administration has said they have the authority to extend these contracts. And while we might all agree that procurement needs to be extended for stability purposes, our role as the legislature is to appropriate money. When we put something into law, we should be prepared to defend it and to have clear understanding of how much authority departments have. And so I've raised this issue with you. I will continue to look into it, and we will have a procurement review at some time as we approach session. Senator Abler, to that point?
Yeah, just briefly, I can't even talk. I appreciate your concern about dates we put down and we pass a law and they should follow the law. But sometimes, like the GPS says take this road and it's actually over a cliff, and you might decide, I think the office had a thing they turned into the lake.
Into a
one
lake,
time.
yes. I'm
She knows
familiar,
these
Senator
things.
Abler.
And so I think that I agree that they should follow the law. Well, there's a stretch. But there's certain times when things are in such a state that it's not good to go ahead with that. And I think in the case of county services that would have been harmed and undoing decades of really good work, that I think that in this situation, it was prudent, and I'm glad that they put the clutch in on it. But I just wanted to feedback about that. Thanks.
Senator Abler, as I said, I think there's broad agreement that not doing the planned procurement was a wise choice. But our question as legislators is if the Department of Administration can extend contracts for 2 and 3 years when we put time certain, we should pay attention to that, because otherwise, what is the point of us putting a time certain? And I am not saying it's a bad decision. I'm saying it's something we need to be cognizant of, because it could be used for many other purposes that we may disagree with. And so I think it's something we're going to pay extra attention to.
May I just?
Yes, Commissioner.
Thank you, Chair Benson. Just for total clarity, I want to be clear that our General Counsel's Office in the Department of Human Services and the General Counsel's Office in the Department of Administration checked, and we're quite sure that we followed the statute in this situation.
And Commissioner, I respect that. You're part of the executive branch. It is your job to protect an executive position, but the legislature hasn't had an opportunity to evaluate and weigh in on that, and I'm calling out for my members that will be part of our responsibility going forward. I do not disagree with delaying the procurement. Let me be clear for all the stakeholders who are now getting a little itchy, sending text messages. I do not disagree with delaying the procurement. This is a legislative versus executive balance, and we have a responsibility. I want to make sure my committee members are cognizant of this authority that has been taken. So I want to thank you very much for the work you've done. Mr. Greenman, can you do 10 minutes on administrative adjustments to the forecast? You and I had a rather brief conversation about it. Members, the reason I asked for this extra information, in 2016, there was a $48 million adjustment, and I, for the life of me, could not find the number 48 million anywhere. And so what I've asked Mr. Greenman and the finance people at the Department of Human Services to give us a schedule of errors and administrative adjustments that the average person could find and understand. And so that's where this schedule came from. I believe this will be an iterative process. Mr. Greenman and Ms. Kutska have made suggestions for changes. I am open to suggestions from all of you, but Mr. Greenman, if you could walk us through some of these special adjustments.
Certainly, Madam Chair. My name is Dave Greenman. I'm the Budget Director at the Department of Human Services. And in response to Senator Benson's request, we did look at compiling a list of adjustments that would not be driven by updated base data, econometric or statistical modeling, the economy, or any other external factor. So in other words, we looked at adjustments that were within our control. And what this list in front of you includes 8 items. It represents, one thing to notice, it represents changes from the end of session 2019 forecast. So this just basically represents the adjustment that we did in the forecast due to things that happened between the end of session and the November forecast. And this also just shows state funds, just so you're aware of it. So of the 8 items on the list, the first one is the IMB federal settlement. This, as Senator Benson noted, there was we noted $48 million costs to the state to repay the federal government for IMD services that were not eligible for federal funds. In the November forecast, we're showing a cost of $61 million. What you're seeing here, so that's about a $13 million increase, and that's due to actual, the increase is due to actual claims data that have been coming in that we're seeing that we can now sort of more precisely figure out what exactly it is we owe the federal government. What you're looking at here is a total general fund impact of about $35 million. And the reason that doesn't add up to 61 is because this is, again, is the change from the end of session forecast to the November forecast. And so of that 35 million, like I said, about 13 of it is our adjustments to the amount that we actually owe the feds. And the remaining amount is recognition that we're not going to be able to get a federal match on IMD services going forward. The second item is our Community First Services and Supports program. This is, when it gets put into place, will be the way we deliver personal care attendant services. And we had planned to implement this in May of 2020. Due to some systems work that needs to be done, we're going to be implementing it in June of 2021. So this has an impact. The reason this has an impact on the forecast is because we get an additional federal match on the CFSS services. We get an additional 6% federal match. And so by delaying this for about another year or 13 months, there's a cost to the general fund of about $66.4 million in fiscal years 20 through 23. The next item has to do with direct access implementation delay for CD services. What we're doing is we're delaying direct access. Direct access would essentially allow a client to go directly to a provider of their choice for assessments and services, as opposed to going through the county or the tribal providers under Rule 25. We're delaying this from July 2019 to July of 2020. There's a small cost of, in 20 through 23, of $7.4 million. The next item is the SEIU agreement impact on PCA rates. This recognizes that a PCA rate reduction accounting for an expiration of certain holiday provisions would not occur as expected. We expected at the end of session that there would be this reduction. Interpretation of the law found that there would be that reduction would actually not go into effect, and so the expiration wouldn't go into effect, and so that adds about $8.8 million to the cost. The next item is a little more complicated. It has to do with our basic health plan. What it does is it recognizes that when we go to the federal government to claim our funds, the federal dollars that we draw down for our basic health plan, we're not able to, our METS data system doesn't have all of the eligibility data that we need in order to allow the actuaries at CMS to actually put the data into their systems and figure out exactly what rates we need to put on those people and exactly what amount we can draw down. As a result, we are not able to claim dollars on those people, and that's about 5% of our BHP enrollment, our Minnesota Care enrollment. And these are people who are eligible for the program. They're eligible through MMIS, but we need to use METS data in order to verify how much we get from the federal government to actually draw down the federal funds. And so as a result of that, it's a loss of about $76.7 million in federal funds over the 4-year period. The next item is IMD enrollment. These are institutions for mental disease. And there was a technical change in the forecast that determined that we had made a mistake when we looked at this population. We had sort of double counted some people who are both in an IMD and on managed care in the same month. We double counted those folks. We only should have counted them once. So over from fiscal year 19 to fiscal year 23, there's about an $86 million savings to the general fund as a result of that change. The next item has to do with behavioral health care, the county share. As you recall, last year, there was some legislation passed that eliminates the county share on CD services that are covered by the MA program. There was an error in the effective date. It should have been July 1st. The legislature paid for the effective date to be July 1st of 19. However, the effective date was made July 1st of 2020. And so what this does is it recognizes in the November forecast a savings, which results from the fact that the county share doesn't go away until 12 months after we thought it would at the end of session. Then the last item is tribal MAT. What this recognizes that includes a federal repayment from the state of about $28.8 million in fiscal year 21 for historical overpayments for the MAT services. It also includes, under current law, a $28.8 million collection from the tribes in fiscal year 21 at the same time. So essentially, this is offsetting revenue and expenditures, and so there's no fiscal impact in the forecast, but we wanted to call that out as an issue that we knew people would be interested in. So those are the 8 items briefly, and I can certainly answer questions if there is any.
Members, Senator Nelson.
Oh, thank you, Madam Chair. I have questions about 2 of the areas. One has to do with the problem with METs, and I'm not sure if it would be Mr. Freeman or the commissioner, but first I want to make sure I understand what the issue is, and then I want to talk a bit about more the problems with METs. So 76.7 million federal funds lost over 4 years because because our METS system is not able to input the correct data regarding a person's eligibility. If that's correct, that's what I thought I understood you to say. My question is, number one, you said they were eligible, but our system is not putting in the data to show the feds that they're eligible. And I just want you to speak to that. I mean, $76 million, almost $77 million is a big thing. And to think that our system does not accurately put in the data points needed to secure that federal funding for eligible people, I think we should take a look at that MET system. And the problem is, so that's a new problem with METs. What I know about METs is that my county, Olmsted County, has had to hire 8 additional full-time workers for the last few years to manually do input instead of METs, because the MET system does not work. You can have multiple people in there. It doesn't, if they start with one person, they put in the system, and then it doesn't complete, and then they call back 2 days later. Then it's a whole new person. If you haven't done a METS write-around, I encourage members to do that. I spent a morning with my county on what I call a METS write-around. And I guess I want to know what's going on with METS, and when are we going to fix this? We've had our counties paying for employees because it's not working, and now we hear today that there's almost $80 million of federal money that's not coming in because METS isn't working. So I don't know who wants to briefly tackle that. Maybe we'll have a full hearing on that, but I think it's a significant problem.
And Senator Nelson, the problems with METs are ongoing. I think it's worthy of a separate discussion. I don't want to put Mr. Freeman on the spot for something that he isn't, it's not his area of expertise, but you did a pretty good job of explaining on our phone call. So perhaps that succinct answer is sufficient for today.
So, Madam Chair, Senator Nelson, the issue with METS is that in this particular case, the $76.7 million, is that we have METS eligibility system, and we have an MMIS claims payment system, and those both should interact with each other. There should be an interface between the two. The problem is there's not, and so what happens is we get a prospective payment from the federal government for our basic health plan based on our forecasts. And that provides us with a certain amount of money for the quarter. Then at the end of the quarter, we have to give the federal government our METS data so that they can go in and plug the numbers into the rate cells, the actuaries. So, and essentially, we're not able to pull the data out of MMIS well enough that we can actually use that in populating the rate cells. And so it's an interface problem that's been going on for a while. It is something that we've been manually working with Minidon to try to solve and reduce the amount of error. Right now, we've got it down to 5%. Our hope is to get it down much lower than that. I think at this point, though, we're not comfortable assuming a lower than a 5% error rate because we want to, or not error, I shouldn't say error rate, but lack of match. So we're holding at 5% right now, but I think if we are able to get it down further with confidence, you'd see a reduction in this, we'd see a reduction in the loss of federal funds in the forecast.
Thank you. And Madam Chair, just
Senator
one
Nelson.
comment. I appreciate that explanation and hope we can get to the bottom of this. And I would just say, I hope that's not what we would see if we broke up the department, where we'd have these two different departments that were not interfacing with one another or not getting the right information from one department to another. That just exemplifies one of the concerns that I have. And there may be more. I'm going to be open, but I want to make sure that that's noted.
Further questions from members? Mr. Freeman, I appreciate your work so much on this. We are going to continue to move towards the legislature being more engaged in understanding the financial status of the department. We have a huge budget. We worry about things like $250,000 grants, but I'm hoping we can take an ongoing systemic approach to the way we evaluate changes to the forecast, and I know you put significant work into this, and so I want to thank you very much. And with that, members, as you know, Ms. Todd Harlan is leaving us on January 2nd. This is her last hearing, and as with all of our staff, we can't do what we do. We get to sit here at microphones and look really smart in press conferences, but it is our nonpartisan and partisan staff from both caucuses that really help us do the work we do. And so, oh, God, I didn't know I was going to do this. I nicknamed her Tenzing Norgay. Those of you who know, Tenzing Norgay was a Sherpa that helped Sir Edmund Hillary get to the top of Mount Everest. And I could not have done any of the work that I've done without somebody doing the significant heavy lifting. So every time you think I look smart, it's because somebody got me the information I needed. And if you think I'm not doing the job right, that's probably my own personal weakness because I didn't listen to the people around me. So I want to say a very sincere thank you, Andrea, for the work that you have done for the Senate caucus, for this committee, and for all the stakeholders who watch the work that we do every day. It matters a lot, and you made a difference, and we are grateful.
Madam Chair.
Oh, and Senator Abler. I thought I was, can I just have the last word one time?
I think she's been amazing, but I've never heard the word Sherpa in a big accolade. That's pretty good. Thanks. She's been awesome.
And thank you. And with that, members, we are adjourned.